Your blood has healing components such as these platelets, as well as growth factors and nutrients, as well as plasma. These can be concentrated down and injected into damaged knees, the rotator cuff and shoulder, the elbows such as tennis elbow, the hands and the wrists, even the spine, cervical, thoracic, and lumbar, as well as pelvis and hips, and the TMJ. At Gecko, we also use honey matrix, which can make PRP work better. In some cases, we consider adipose stem cells because fat has such a high population of stem cells. Using the stem cells from bone marrow is also very powerful along with PRP. Gecko is one of the first clinics to actually offer bone marrow and adipose combined together in the same treatment. At Gecko Joint and Spine, we can both diagnose your problem as well as guide our injections to precisely the right area using high-definition ultrasound.
All right.
Come on, Jeff. So this is the before. How you feeling?
Not so hot, man. A lot of pain.
Yeah.
All right, rock and roll.
So we've already seen you come in crutches, right?
Yeah.
What's it been like the last few days?
John, I have been in the worst pain the last 5 or 6 days. I mean, literally crying in pain.
Mm-hmm.
And the level of pain, you can't sleep at night. And it's just, you try to stand on it, you try to walk on it, on this leg, this right side.
Mm-hmm.
It was so painful.
Mm-hmm.
I can't even tell you.
A couple days.
Well, about 5-6 days ago, John, I woke up in the on the morning and I had this really horrible pain in my right glute, and I thought maybe it was my sciatic nerve. I wasn't sure what it was, and it got worse and worse and worse, and it moved even over here to the groin area, and I couldn't even walk. I came in here in crutches today, and the pain was so unbearable. You know, I mean, you'd try to stand up and get out of bed in the morning and you'd fall down. You couldn't even get to the bathroom. Well, I go to the ER and they treat you and street you. I mean, you know, they did an x-ray and, you know, and said
Street, yeah. Street, yeah.
and it's like, here's 3 days of pain pills and here's our guess of what it was. So they did some labs, they did some vitals, all seriousness, labs, vitals, made sure that nothing was wrong there. And then, you know, they say, well, you know, give you 3 days worth of pain pills, and they didn't know what it was from the x-ray. And so it was getting worse and worse and worse. The pain pills didn't really do much, which I don't like taking them anyway. I mean, the first 3 days I gutted it up and didn't do anything, and it got so bad when I got out of bed because of the pain, and this whole right leg shut down. But I said, I got to go in. And so then I made the effort to come here, changing my flights, changing everything to come see you, because I know, you know, I can trust you and you're going to do the right thing. So I come in to see you, and you know, the MRI shows that it's, you know, maybe it's a disc, you know, that's a herniation, you know, could it be the sciatic nerve? And I mean, within minutes you diagnose it and say, no, it's your hip socket. And you do these injections in the hip socket, in the front and the back. And I mean, John, I'm like a different person. I mean, I feel like the cloud has been lifted. I'm out of pain. You know, for the first time in a week. You know, trying to cry yourself to sleep. I mean, I actually think I'm going to get to sleep tonight. So thank you.
You're welcome.
For more information about these exciting regenerative therapies, you can find us at advancedrejuvenation.us. You can also contact us by phone at 941-330-8553 or email us at info@advancedrejuvenation.us. If you found the information on this video helpful, please like us and share us on Facebook. You just never know whose life you might touch. Well, thanks for joining us. And remember, if healing is possible, consider it to be within your reach. Bye for now.